This is my brain. Not really, trust me. You'll find out in the next little bit because we have the experts who can figure it out. With us is Dr. Cathy Ballyk. Lisa Fronzi's here, Brant Community Healthcare System. Ladies, both, thanks for coming in today.
Thanks so much for having us.
So is this big news we're talking about here in terms of what's happening for our area?
Yes, it is. This has been in the making probably for 25 years, but in the last 4 or 5 years, more intense.
So as a doctor, your part of this is?
Well, I'm the clinical director of our stroke unit with Dr. Schott.
Right.
And I'm also one of the physicians in the Brant Community Healthcare System that does TPA, gives the clot busting drug to patients in the ER when they first have their stroke.
Okay, so Lisa, as part of the healthcare system, your part of this is?
Well, I'm the team leader for the Brant, Haldimand, Norfolk District Stroke System, and we're very excited that starting June 1st this year, we opened up our integrated stroke unit serving residents of Brant, Haldimand, and Norfolk. So we're very excited about our integrated stroke unit. There's great evidence to support stroke units, so we're excited about this great unit that's now providing best practice care to residents in our district.
It really is fabulous because Dr. Ballyk, the one thing that's always stuck in my brain is when my son's 23-year-old friend had a stroke.
Okay.
Wasn't overweight, didn't have the other health risks, and he had a stroke. And it took me a little while to process that, going, wait a minute. It doesn't work like that. So I guess in terms of stroke, and you brought the brain, I guess, to give us a little show of what's going on, it can happen to anybody?
Yes, there are risk factors, but some people don't fit that pattern. And the risk factors are high blood pressure, smoking, high cholesterol.
You know what I haven't asked you?
Family
What
history.
is a stroke?
Okay, what is a stroke? Well, basically a stroke is part of the brain has a blood supply.
Right.
And the brain is also responsible for all the movement in your body, as seeing, talking, feeling things. So when part of the blood supply is not available to part of the brain, whatever part of the blood supply is damaged, supplying that brain tissue, then the patient will have what's a stroke. In other words, if it's where their arm movement is, they won't be able to move their arm.
So blood problem in the heart, that's your heart attack. Blood problem in the brain, that's the
you
stroke.
got it.
Okay, so
sometimes they call it a brain attack.
So the stroke unit itself, what does it now mean? Is it increased quality of care, survival rates improving? Exactly what does it mean at BCHS?
Yeah, that's right. So basically our stroke unit provides acute and rehabilitation care to patients who have strokes. And as I said, there's very good evidence to support stroke unit care. We know that patients cared for on stroke units are more likely to be alive, independent, and living at home 1 year post-stroke. As well, there's a greater reduction in risk of complication post-stroke when patients are cared for in our stroke unit. So we have a great group of staff working on our stroke unit who are specially trained, and they work as a team to provide that expert stroke care to our patients.
I'm happy to report at 29, this friend of my son's is probably about 100% back. You'd have to know what happened. So is that the goal in most cases, that a stroke sufferer will end up, just back like you and me?
Well, the goal is to get them as independent as possible. And often, especially with this new clot-busting drug, we could certainly get very good improvements. Sometimes people are maybe 80%. They might still find that their arm is a bit weak, their leg is a bit weak, their speech might be affected, but certainly we have much better recovery rates with the fact that we have coordinated care on the unit. And therapy is a very big, and nursing care is a very big component of stroke care as well. When I started, we used to put stroke patients in the back of the ER department. We couldn't do anything. When someone had a stroke, we were sort of at the end of the shift, go just check to make sure they're okay. Now, patient comes in, they're treated just like a patient who had a heart attack. They're given the medications, they go to the critical care unit, they get a lot of different imaging in order to help us decide how to prevent the second stroke sometimes people can have a second stroke, but with these new medications, we often prevent that as well.
Ladies, thanks for coming in. We appreciate the information. Coming back with Sid next, Inside Brant.